Andrew, welcome to the Men Made for More podcast, man. Stoked to have you on here.
Hey, happy to be here. Thanks. I really appreciate it.
Yeah, no, looking forward to hearing a little more on your expertise. And why don't you give people listening just a background, as brief or in depth as you want to on your story personally, professionally, what's up with the Charlotte athlete and kind of what you're doing, who you're working with, and what you're up to now.
Yeah, of course. So I'm from Philadelphia originally and got my physical therapy degree. I'm a doctor of physical therapy in Fort Lauderdale, Florida at a school called Nova Southeastern University. After which I moved to Houston, Texas, where I completed an orthopedic physical therapy residency and a sports manual therapy fellowship program. I since moved to Charlotte, North Carolina, which is where I'm at now. I received a few other, so I'm one of the few physical therapists in the country that are both dual certified in orthopedics and sports and have done a residency and a fellowship, which all that means is that I'm just really passionate about what I do. I'm also a strength coach. I'm a USA weightlifting coach, and I own my own practice, which is called the Charlotte Athlete. And this practice is a non-insurance, a cash-only practice where we treat almost exclusively athletes, more active individuals, weightlifters, CrossFit, Orange Theory, runners, everyday gym goers. Just basically, if you're active and you want to use your body the way you want, any way you want, we're here to help. The last thing to add in here is I also do quite a bit of teaching. So that fellowship program I mentioned, I am faculty in this fellowship. It's called IAR, which stands for the Institute for Athlete Regeneration. So I teach both locally in Charlotte to physical therapists that fly in from around the country for weekend courses, but I also teach frequently in Phoenix and also in Texas, specifically Houston, sometimes Dallas. And I've also worked with through this fellowship program, a number of professional sports teams through the NFL, NHL, and the NBA. So I'm excited to be here and, see if I can offer you all some insights as to, some in-depth look at the topic on hand.
And I'm excited for this one because as you guys can hear that are listening, you're pretty much a genius in the field, man, leading the way. And I mean, you're the one teaching the professional teams, healthcare professionals and physical therapists from all over the country, helping them become better practitioners. And like I said, I know your passion is there. So I'm excited to talk about this, especially as we get into low back pain, which is, I know, an area you're passionate about and so knowledgeable in, and one that's just so prevalent. Anyone listening probably has experienced back pain at some form or another. You're probably better at the actual statistics than I am, but chances are that if you're listening, you've probably had either some kind of injury, some kind of back pain, aches, things that come up, because it's the most common thing that we tend to see. And I know it's heavy in your practice too, but I think a good kickoff in this topic is like, what are the layers behind back pain? Why does back pain even happen? So I think you and I know it's maybe not as understood as people think it is. And people might have some misconceptions about why it happens. So what are some of the, things to consider? Where do we even start when it comes to why does back pain even begin in the first place?
Yeah, Dave, you're exactly right. I mean, low back pain is so dang prevalent. It's the number one area of the body that I treat in my practice and that work with athletes with, and it's everywhere. And yeah, if you're one of the lucky ones listening that has not experienced low back pain yet, I mean, there's statistically a good chance that you will at some point in your life. So yeah, I mean, the big question is why. Why is this so prevalent? Why is this, causing people to seek medical professionals and keep people from, being in the gym and affecting the way they live their life. And it's one of those, very commonly misunderstood areas, but, everything does happen for a reason. Okay. And so we need to, in order to really understand why low back pain occurs, you really do have to dig deep and peel back the layers. So, so I guess just for simplicity's sake, for what I'm going to mention now, it's related towards back pain that occurs without any specific injury associated with it. Okay, so this is non-acute, there's no event that you can identify. This is low back pain that starts to develop over time. And we're going to dial in here first. So And also just one side note on that. I mean, this, while we are going to talk about this, a lot of what causes this type of low back pain is the same thing that sets the stage for acute injury to occur anyways. So I say it's more towards a no specific event. I guess what I'm really referring to is no like freak car accident or something like that. So, so yeah, I mean, the vast majority of lower back pain happens because of the way that we move. Okay. The way we move our bodies, the way our body can function as an entire unit. And so what can happen is we can develop poor movement patterns. Okay. And we want to ask the question, why do we develop poor movement patterns? Well, sure, technique can be a part of it. Sure, lack of warm up and all that. But vast majority, we move poorly because we have imbalances within our body. Imbalances, not just from a mobility standpoint, mobility meaning just the ability of your body to obtain certain positions or certain ranges of motion, but also from a strength or stability standpoint and how well we control that. So we move poorly because of imbalances we develop within our body, but we got to go further, okay? Why do we develop these imbalances to begin with? So basically that boils down to what we do day in and day out, throughout the night, throughout the day. What positions do we sleep in? What is the quality of our sleep? That can certainly create some big differences within the body. What do we do for work? Are we sitting all day? Are we standing all day? Are we doing the same repeated motions over and over again? And also, exercise. What are we doing for exercise? What does our programming look like? Do we have balance in our programming? How many days a week are we exercising? It's all these factors, sleep, exercise, work being the big three. Over a long period of time, you can develop, these imbalances, which cause you to move poorly, which then results in some sort of back pain.
Yeah. So here you talk for people, like, so there's a lot that goes into it. And I think it's, it sounds complicated, and it sounds like, for people listening, it's like, wow, there's a lot of factors that go into it. It's not just the deadlift I did where I started to feel my back pain, or it's not just the CrossFit workout that caused my back to be sore, and it's sore since. This has probably been something that's building up for tens of thousands of repetitions and many days, weeks, months, years, even for most people to do that. So when it comes to all those things you mentioned, and sleep, exercise, work being the big three, where do you recommend starting with people? If someone's listening, they're like, wow, that's a lot. Where do you recommend starting, even with all those things in mind, for someone that's dealing with this pain?
Yeah, so obviously there's a lot of variability in terms of the different imbalances that can occur and the different movement patterns that can occur. But, I'd love to dive into some of the most common, common areas, kind of a shotgun approach, which does apply to the vast majority of individuals. And yeah, so let's chat about each of these three. So sleep is huge. Sleep, I think, is one of the most overlooked aspects of our lives that can significantly increase the chance of developing low back and neck pain. Not to get off topic there, but in my opinion, I think sleep, specifically stomach sleeping, is the number one risk factor for low back pain. I can't tell you how many individuals sleep on their stomach, that come through my door, sleep on their stomach, and wake up, with stiffness and pain in the morning. Or they sleep also, which is equally as bad, in the infamous, I call it the mountain climber position, where you're kind of on your side, slash stomach, that kind of top knee is hitting the mattress, kind of up closer towards the waistline. That puts all kinds of twisting torque on the hips and low back, and really sets your body up for failure. So, sleep is a time that we're supposed to be recovering. We're supposed to be healing, and if we're putting our bodies in a poor position for hopefully 8 hours, I mean, that's a long time to be in a poor position, and your body's not gonna be able to recover, from its daily activities. So first and foremost, sleep, specifically stomach sleeping and mountain climber sleeping, those are two major risk factors for low back pain.
Do you recommend people on their back or sides, or what do you tend to recommend for people that are stomach sleepers?
Yeah, I mean, it's a process. Most stomach sleepers have been in that position for most of their life. So, it's something where I recommend start off spending 10 minutes each night. Either on your back or on your side, ideally with a pillow between the knees, or at the very least, just keeping the legs stacked. Those positions are certainly fine. But it's something that, you can't just, it's not a habit that you can just make an instant change with. The goal, is to spend all night either on your back or your sides. However, it's something that likely has been going on for a long, long period, and that you need to, just stay consistent with, and just try to spend increased time every night in those positions. And what you'll find is you'll wake up feeling more refreshed, like you can hit the weights harder, longer, and you'll feel better. So yeah, two great places to start. So yeah, I guess kind of moving on then to, we're going to talk quickly about work and exercise. I mean, we all know that sitting all day and then going to the gym without warming up is a recipe for disaster. And, the main reason is because when you sit for that long period of time, three main areas get stiff: your hips, your hip flexors, and your upper back. So if you recall, earlier I mentioned the body, it's like a big machine. You have a bunch of moving parts. It works as a unit, and if you have stiff areas, like if we're talking the low back specifically, you have stiffness in your thoracic spine, which is that mid-upper back, because you've been slouching behind a computer all day. And then you have stiffness below the lumbar spine in the hips and the hip flexors. Well, guess what? You got this kind of sandwich effect. It's going to cause increased motion in the lower back. And anytime you have increased motion in a particular joint or any area of the body, that's where pain occurs more often than a stiffer area. So if we're sitting all day, our hips get stiff, our hip flexors get stiff, and our upper back gets stiff, and then we go to the gym and do some half-ass warm-up or something that doesn't even relate to the the exercises we're going to perform, then yeah, that's a major risk factor, a reason why individuals get pain. The sitting example is probably the most prevalent to get into. There's other specifics for people that stand all day, but to be honest, the reality is you want to mix. You shouldn't sit, or you shouldn't stand all day. The best thing to do is move around. So if you're one of those individuals that spends a lot of time behind the computer or traveling or commuting to work, throughout the day, the goal is to take a lot of breaks. Hopefully a stand-up desk is a really good solution to help break things up. You kind of want to just mix it up in terms of spending some time sitting, sometimes standing. A great ratio you could do is something like, let's say 40 minutes of sitting, 10 minutes of standing, or 15 minutes of standing, and then 5 minutes of walking around, kind of changing things up, maybe doing some different mobility drills or anything specific to your body. And you just repeat that all day long. It's just the prolonged positions, they wreck our bodies long term, and it's one of those things that can really add up and create those imbalances.
Yeah, I think that's huge. And I think an important note on that too is people think that there's such a a buzz towards standing desks that people are like, oh, but I'm standing for 8 hours a day and my back still hurts. And standing is still a sedentary position. Like you said, our body wants to be moving and changing positions, and that's where moving from sitting to standing, taking a walk is going to be better. Some mobility drills, even dropping, if you have a pad, you can kneel down and stretch your hip flexors out during there's lots of ways that you can incorporate movement in without having to really take we're not asking you to take a half-hour break every hour. We know you have work to get done, but I think it's important to note that that's those fluid postures are what's better than any kind of sedentary posture, even if that's standing.
Yeah, 100%.
So when you talk about, I want to circle back on when you talk about, so sitting stiffens up our hips, stiffens up hip flexors, stiffens up our upper back. And you mentioned that creates more movement at the lower back, where the lower back isn't meant to necessarily be an area where we want to see a lot of movement from. And that can be due to stiffness. That can be due to just a lack of awareness. But what does that actually look like for people listening? So they don't warm up, they sit all day, they go to the gym. Let's take CrossFit as an example. They're doing all these movements. What does it look like that they're getting more movement from their lower back, and how does that impact their back pain?
Yeah, great question. So I think the simplest way to look at this is when our lower back deviates from its neutral center position in either direction, forward or back, that's what leads to issues. And so if our lower back goes forward, that's going to cause it to arch or extend. If our lower back goes the other direction backwards, that's going to cause it to essentially round or, kind of flatten out. And so a healthy lower back is going to stay right there in the middle. Whenever we have tight hips or the upper back is stiff, or heck, you can even have tight ankles, and that could influence how your back moves. It's going to increase the chance that you will deviate from that midline. And so let's kind of spend a moment and talk about each one of those and kind of what that looks like. So anytime your lower back excessively arches, it's going to end up causing more pain, whether it's during or after or long term. And anytime it rounds too much, that's typically where you're going to get that blow up the back kind of extreme tightness or fatigue feeling that, experiences with, high rep deadlifts and the sort like that. So let's just spend a moment and talk about what each of these looks like. Let's start with extension, because that's the most common movement pattern in the lower back that leads to lower back pain. Okay. So what is that? So it's basically anytime your back excessively arches when you're performing different movements. And so if we were to use CrossFit as an example, there are a ton of exercises in CrossFit that if you're lacking midline control can lead to extension. And so some good examples would be like a burpee that looks like a worm versus, like a push-up. Or if you ever see someone go down into a squat and then when they come back up to the starting position and they throw their hips forward too far, that will cause arching the low back. Or if you're pressing weight overhead, doing a shoulder press, push press, push jerk, split jerk, whatever the case is, letting your ribs flare up, that's going to cause arching the lower back. American kettlebell swings, if you're sending the hips too far forward as you're raising that kettlebell over to the overhead position, especially if you have tight shoulders, that's going to increase the chance that you're going to arch the low back. And so this repetitive arching that can occur with a ton of movements, over a long period of time, that's what's going to really, irritate the low back and lead to pain. The other direction is what typically causes your low back to really burn out quick and get that really fatigued kind of tight feeling. Okay, so I mentioned that extension is the most common movement pattern that leads to lower back pain. Well, if you think about it, if your lower back is constantly arching or extending, then the muscles of the lower back, they're going to get shorter, okay? The muscles in the front, like your abs, they're going to get a little bit longer and weak. So the muscles behind your spine, they're going to get shorter, okay? And then if you then stress it to get from like a deadlift or anything that may cause some rounding of the low back, you're essentially lengthening those muscles a little bit. And then you're asking them to, to basically stabilize your whole body, especially anytime the weight is in front of you. And that's going to cause them to really fatigue out and kind of burn out. And so the most common exercises that cause that burnout feeling, that extreme fatigue feeling in the low back, is really anything where the weight is in front of your body or the weight of your body is up or pushed onto the toes, onto your forefoot or your toes. So let me give you some examples of each. So when the weight's in front of your body, that could be like a power clean, a front squat, overhead squat. That could be like if you're doing like a goblet step up or a deadlift or a bent over row. Every single one of these exercises are the most common exercises that, cause that extreme tightness in the low back. And every one of those has the weight in front, of their body, or exercises that cause you to shift towards your toes. I mean, a lot of what I just mentioned there causes you to shift towards your toes. But also, things like if you're doing a burpee, I mean, the reason why the burpee is a common exercise that leads to issues is because you have both the low back extension problem, but then you also, if you don't jump your body close enough to your hands when you're going to stand up, you can really shift your weight on your toes rep after rep after rep. But yeah, if you're letting yourself drift too far with any version of the squat or, lunges, I already mentioned step ups. So those are just a really good example. Anytime you tend to shift towards your toes, that's also going to increase the chance that you get that really, really tight low back feeling. So, I mean, as you can imagine, if you're not careful with simple technique things, like I just mentioned, and keeping your back neutral, then it could really give you a high chance of developing some kind of tightness or low back pain. And especially if you got, if you got imbalances from a mobility or a strength or weakness perspective, it makes it even harder to hold a neutral position.
So I think for people listening, like it's got to be pretty clear that technique is. It sounds like, you can correct me if I'm wrong. Technique seems to be like, oh, cool. Well, we're gonna jump into the next question. Yeah, we had to take a quick pause on the show. Andrew just had to get up and move around. He's practicing what he's preaching, or it's just someone else needed the treatment room. But either way, he's in a nice hip flexor stretch position now as we keep picking up. Because I wanted to follow up with that last question of, so you're talking a lot about technique, and I think it's pretty obvious for people listening, I hope so, that technique seems to be the glue that's really holding everything together. Because people experience back pain, and at least in the people that I work with come in and they say, well, I've tried stretching, I've tried strengthening my core. We'll maybe get into that later of what strengthening your core actually means. But people try and address back pain by like stretching and strengthening their way through it, when that's not a complete picture. That's not a complete piece of the puzzle if we're neglecting the movement side of it, which seems, correct me if I'm wrong, seems to be the most important factor. Because if you're just trying to stretch and strengthen your way around it, but you're doing step ups, you're running, you're doing burpees, you're biking, you're lifting, and you're not moving in a way that's avoiding stress on your back, then pain is going to continue to be present. And would you agree that it's not enough to just stretch and strengthen your way out of back pain, that technique should be the first place that people look?
Yeah, 100%. I mean, it all ties together in a sense. You know, our poor movement patterns need to be addressed for sure, but that also ties directly into, mobility work and proper core kind of stability, core strengthening. Um, so it's, yeah, movement retraining is, at least that's what I call it. I mean, that is a major component of rehabbing or or preventing low back pain from occurring, whatever the case is. You have to move well, and that ties in, yeah, with mobility and strength. And here's why. And also, you kind of mentioned we might dive into the core stuff. I mean, this is a good time to talk about that as well. Um, in order for you to move well, you have to have good, adequate motion, throughout your entire body. Like the example I used for the low back, the hips being stiff. I mean, if you have stiff hips and you try to maintain a more neutral spine, it's going to be hard. If you have your hip flexors are just constantly pulling you into more lower back extension, it's going to be hard for you to train your body to move better. And then, yeah, if you have weakness from a stability standpoint, it's going to be hard. And so let's for ease of kind of kind of describing or connecting all the dots here, let's just say that our mobility has been restored to as normal as we can get it via drills or hands-on work from a practitioner or whatever the case is. Okay, so now we got to train our body to essentially not extend or rotate as much as it's doing, which is what is leading to issues in the low back, tightness and pain in the low back. And so the big miss, I think a big reason, a big kind of confusing point that not only athletes struggle with, but also practitioners, is there's a difference between strength and stability of the core. You could have a 6-pack, you could have an 8-pack. That has no correlation with low back pain and whether or not you're going to get it or have it. Basically, our core is the center of our body. It's the foundation of our body. It needs to be still, it needs to be firm, it needs to allow safe motion of our upper body, our arms and legs. It needs to, our core is built to prevent motion, I think is the easiest way to say it. So our core is built to prevent motion, not create it. Okay. When you have excessive motion in your core, which is also excessive motion in your back, that is what leads to pain. That leads your back to extend and to rotate excessively. If if you're a rotational athlete, and that leads to pain. So we need our core, we need to train our core to be solid, to be still. So the easiest kind of differentiator here would be a sit-up versus a plank. A sit-up is training your core to move your spine. A plank is training your core to prevent motion at your spine. Okay? And because, yeah, you can, I mean, look at how many pro athletes are out there that have been dealing with low back pain, whether it's, you know, Tiger Woods or whether it's Rob Gronkowski, whoever the case is that has an 8-pack abs. Essentially, their core is just not able to provide a stable environment for their spine based off the, you know, whatever their demands of their sport are. And so they're getting excessive motion in their back. And one important solution for what they need, or any athlete, I should say, is they need to train their core to essentially prevent that motion from occurring. And so this is where exercises such as they're called anti-exercises, anti-extension, which would be a plank, and anti-rotation. Those are the two key areas that you want to dial in at. So let's just clarify what I'm talking about. The plank, if you were to fail the plank, let's just say failing, well, if you fail the plank, your hips are going to drop to the ground, right? Your back's going to go into extension. So that is an anti-extension exercise. You're training your core to prevent the back from arching, right? From the rotation standpoint, my favorite type of exercise as far as anti-rotation, and I think it's probably the most popular group out there, are the Pallof presses. You guys have ever heard of the Pallof press? It is an amazing anti-rotation. There's a few anti-extension versions. There's a lot of different varieties, but a really amazing anti-rotation exercise that you can perform in a number of different ways that can really provide stability for your lower back. If you're, hop on Google, if you've never heard of Pallof presses, or go to YouTube and type in Pallof presses, you'll see what I'm talking about. It's really good anti-rotation exercise. Really effective to help train the core to prevent movement at the lower back. Now, I just want to take it one more step further before I send it back to you, Dave. And it's also important, it's important to know the position that your back is in when you're performing these exercises. So the most common movement pattern that leads to pain, that is when the back is extending excessively or it's overarching. If you were to do a plank, let's just stick with that example because it's pretty, I think it's a pretty well-known exercise. If you were to do a plank and just let your hips sag in and train in extension, it's not going to do you any good. You're basically training your body to hold that extended position. So you need to raise the hips up a little bit. You need to get that back a little bit flatter. You need to get a little more neutral and train it in that position. Okay? Same thing with like the Pallof press. If the Pallof press is a standing exercise where, you could use a band, tie it to a pole, or use a weight stack, and you step out and from a 90-degree angle, kind of perpendicular, it's going to be pulling you into rotation, but you're not going to let that happen. It's an anti-rotation exercise. But if you're standing there in an athletic stance with, your butt sticking out and you got a big old arch in the low back, yeah, you're performing the exercise, but you're performing it in a position that's going to set you up for failure. So it's really important that you achieve a neutral spine to the best that you can first. Neutral meaning not excessively arching, not excessively rounding, just right in that middle. Then you perform these anti-extension, anti-rotation exercises. That's how you can really achieve some good, true core stability that will prevent pain from developing.
Yes, that's so much great stuff there too. And I think that, to summarize a couple of things you said, most people miss the boat on their core training because they're training for flexion, they're training for rotation, they're doing things like, say, a Russian twist where they have a med ball and they're rotating their spine thinking that's helping, or they're doing sit-ups, versus trying to resist that movement is going to prepare you much more for life, for sport, for lifting. So doing things where your spine isn't moving at all, you're using gravity or a weight or something to try and pull you out of that, and you're training your spine and your core to resist the motion, is where so many people miss the boat. And I love what you added to that too, of make sure that you're doing this with good form, or else you're just reinforcing all the bad habits with that. So I think that's I love those points. And I think the majority of your core training should look like this anti-work that Andrew's talking about, of doing things that resist motion, that allow you to better stabilize. So for those that are thinking about how to upgrade their core training, that's something you want to evaluate, is how much do your training looks like. Are you moving from the spine? Are you moving from the lower back? And how much are you resisting some of that?
Right. And the cool thing is, especially if you're a CrossFit athlete or you like to do big body movements, I mean, those are amazing core exercises in and of themselves if you're doing them properly. I'm sure you guys have heard the best ab exercises. Yeah, that's squat deadlift, or that's squat deadlift, bench press, shoulder press, all the big movements. Well, a great example is like the thruster. A thruster, I'm sure some of you guys love it. Most of you guys probably hate it. It's a core exercise, but you are utilizing your legs, you're utilizing your shoulders, your arms. Guess what's in the middle? Your core is working overtime to provide stability. And as long as you can keep that sucker nice and neutral, especially when you're pressing that weight overhead, if you kind of think about your rib cage and try to keep your ribs down and don't let your ribs flare. And when you're pressing the weight overhead, well, that suddenly becomes a really effective core exercise. And a lot of the movements that we do in CrossFit and in at the gym and in weightlifting, they are really good core exercises, assuming they're done correctly.
Yeah, that's the big caveat, is making sure they're done correctly. And that's where locking the, form in it is essential. And I know we went deep on the stability work. We talked about the common mobility areas, but I want to touch back on that, because I feel like we glossed over that a little quickly. If someone is lacking mobility in ankles, hips, upper back, I want it to be clear that if you're missing mobility there, no matter how hard you're aware of your movement, no matter how much you brace stability, if you're trying to press overhead and you don't have any upper back mobility, then it's going to put stress on your lower back. So how do you I know you're really skilled in your manual interventions and your hands-on to help speed these things up. But for people that are doing this on their own, they're lacking a lot of mobility. Where, do you put any brakes on people for form restrictions or anything? If let's use tight hips as an example. Their hips are super tight, so they can't squat down without rounding their back. Are you removing them from the squat altogether? Or are you having them just work on mobility for the time being? Are you shortening up the depth? What kind of strategies do you give for those that are really stiff and really tight? Because I think a lot of guys out there fall into this category.
Yeah. I mean, certainly if they're having pain and they're just feeding into this poor movement pattern when they're squatting, then I'll probably I'll probably just get the barbell off their back for now, just for a little period of time, and give them something that's a little more it's a little easier for their bodies to handle and much safer as we work on improving mobility. So yeah, I mean, there's essentially 5 areas that we need to really pay attention to. 5 main key areas. And so let's talk about these real quick we're going to go from the ground up, because these are the areas that I am working on the most from a hands-on perspective. But I also give all my clients, all my patients, all my athletes, drills that they can work on at home so they can improve and work on this themselves in between visits. And I don't know if there's some links we could pop up. I could post some of these exercises. I have YouTube videos of all of them. But starting from the ground up, the ankles. So there's only one key motion of the ankle that y'all really need to pay attention to, and that is what's called dorsiflexion. That's basically the upward or toes to nose motion of the ankle joint. When you're restricted there, very often it can lead to compensation up the chain. So got to make sure you have adequate ankle dorsiflexion. In the hips, I do divide this into 2 areas. You heard me say it earlier, the hips themselves and the hip flexors. Hips, if we're sitting all day, you're going to get a what's called a tight posterior hip capsule. Basically, the hip joint is tight. All right. And so addressing that specifically in hip flexion, which is basically the knee to chest motion, that's what you need to improve. And you'll do that by addressing the hip joint, the posterior hip capsule. The second one is the hip flexor. Now, the hip flexor, that is another one that it's involved in literally almost every single case of low back pain. It's in fact very rare that I get a case of low back pain that I'm not working on this muscle to some extent. It's located in the front of the hip and basically runs from your femur, which is, you know, the giant thigh bone, connects onto your pelvis and then attaches to all the lower back segments. So when this sucker is tight, it pulls on the lower back and it increases the chance that you move poorly. So there's a lot of different ways to address it. You know, the one though that I find works really well is to get in there utilizing a kettlebell. So I'll post a link to this one, but I'll have the athlete lie on their back with their knees bent, and they'll take the corner of a pretty significant kettlebell, usually 44 pounds or so, and I will show them exactly where you can place the handle of it right on your hip flexor. It's called your Iliopsoas, and they'll spend about 2 minutes just kind of digging in there. That I found works wonders for not only treating low back pain, but preventing it if you're trying to be very kind of prophylactic there. The next area is the thoracic spine. We talked about that. That needs to be improved into both extension, which is bending backwards, and rotation. So there's a ton of different options for that. And then the last one that's often overlooked, people that have low back pain, is their shoulders. Your ability to reach fully overhead. There's a cool drill with a band that I use that is kind of touches on the entire shoulder and all the different muscles that need to be addressed in the overhead position. So we'll get a link for that. But specifically your lats. Tight lats are one of the prime muscles that prevent overhead motion, especially because they actually attach all the way down, run from your shoulder all the way down your back into the sacrum, which is your pelvis. And so if that muscle is tight, it's going to not only prevent your arm from going fully overhead, but it will also increase the chance that you arch at the low back. So that's a pretty key one. But ensuring we got those 5 areas addressed, you know, it's once you put them all together, you know, in a little sequence in your warm up, it really doesn't take very much time at all. But ensuring you address all those will make a major difference in how well your body moves when you exercise. So yeah, I mean, all key areas, recommend everyone to start there because they're so common.
Yeah, that's great for sharing. And if you could send those links over, we can include them in the show notes. I think for people listening, if you just follow those 5, like if you're a candidate of mobility, if you feel like you're stiff, now you can tell there's so many factors that go into this, and you have to be addressing your stability as well. Like Andrew's talked about, you have to be addressing how you're moving. But if you're a stiff guy and you're looking for a place to start, then these 5 are going to hit the major areas. And just following along those videos, would you say daily for those, Andrew?
Yeah, I mean, what I would recommend is, yeah, it would take about 10 minutes to do. I would do them twice daily for 2 weeks just to really get the ball rolling. And then after that, just keep them as a part of your warm up or just do them, you know, once daily. There is one other thing I wanted to point out. I don't know if anyone caught on to that, but I didn't ask anyone to do any prolonged stretches or static stretches. Okay. Pretty much, you know, minus the hip flexor, every single one of those addresses the joint. And so that's key. That's a key area to note in on. You know, we're not doing static prolonged stretching of muscles. We're addressing the joints. And so here's why. So muscles, the job of the muscle is to move a joint, right? And so if, let's say, I'm the muscle and I'm pushing against a wall and the wall is the joint and the joint is stiff, well, guess who's going to break down? Me. I'm going to lose that battle every day. There's no way I'm going to push that wall down. And so essentially, if you take the ankle, for example, if you're lacking that ankle dorsiflexion and your calf muscles, your gastroc, your soleus are unable to move that joint through its range of motion, then I'm going to break down, I'm going to get tight, and I'm going to cause all that tension. And so the issue is a lot of people, they go after the muscle, and because it, you know, feels good, but then it just gets tight again. And so they keep stretching it, and they keep stretching it, and then they're stretching it for months and years, and they're wondering why it's still tight. You know, it's so common with the hamstring, and you know, we can get in all kinds of areas of the body. But if you were to just address the ankle joint, then over time, those muscles will be able to function, those calf muscles will be able to function the way they're supposed to, the way they need to, and then they won't get tight. So it's just a little, you know, a little tidbit in there that, you know, addressing the joint can really make a big difference in improving mobility, much greater difference than just simply stretching all the time. or foam rolling for that matter, which is even worse.
Yeah, I think that's a great point, and you'll see what the exercise that Andrew's gonna provide. But it's very much a movement standpoint, very much a joint standpoint, because that's what's going to create long lasting change. And if you found yourself stretching for any length of, if you've been stretching for even a couple months and you're seeing minimal change, or you come back to the same starting point every time, then you're either addressing the wrong area, you're missing the joint component of it, or you're probably not following it up with the proper stability movement work to really lock that in. So some things to consider: your mobility work should cause change in your mobility, positive change in your mobility. And if it's not, then you need to kind of go back to the drawing board of either what you're doing or how you're going about addressing that.
Cool. Love it.
Yeah. So that's some great stuff. What last thing from a practical standpoint that I think wanted to hit on was, what about hip hinging? Because this is something, I know you've preached a lot on in, the stuff that you've put out, but what is it about, maybe what are the problems with people's ability to hip hinge? First, maybe what brief description of what is a hip hinge, and where do you see common mistakes with it as it relate to people moving from the back versus the hips themselves?
Yeah. I mean, it all ties back into that our body's one big machine, works as a unit. And for all the areas of the body to be healthy and moving well, then they need the adjacent areas, next to them to be moving well, consistently. And so a very common pattern that we see is that the low back is married to the hips, meaning that they move as one. Uh, you know, when you walk, when you jump, when you run, when you lift, it's just very minimal, there's very minimal movement between those two areas. Our glutes are the biggest muscles in our body. They're the strongest, they're powerful. But if you can't utilize your glutes, to help move weight, to help move your body, then it's just going to increase stress on the low back. If you can't utilize your hips and hip hinge at your hips, well, it's going to ask the low back to help out more than it wants to, and that's a big cause of both tightness and low back pain. And so one really important concept that I address, I would say in 75% of all low back pain cases, is improving their ability of their hips to move, and for them to hinge at their hips, so that they're not asking their back to do more than it wants to. I mean, you look at some of these top athletes that deadlift a ton of weight, and you're just wondering how they not blow up their back, how they not, they're pulling, 600 pounds off the ground or 800 pounds, and they're, how is their back able to handle that? Well, it's because they got a really good hip hinge and they're utilizing their hips, versus the everyday athlete that sits behind a computer all day. They get really tight hips, and then they go to deadlift 135 and their back is just destroyed. Well, a lot of that is or they can't keep a neutral back and it starts to round at the bottom. And a lot of that is because they just can't hip hinge. They can't get that hip flexion, moment arm in their hips, and it just leads to just overuse and abuse of that low back. So hip hinging, is super, super key to have a healthy, functioning low back.
Well, I think where people get confused is that they think, they hear, well, I'm not supposed to round from my back, so they associate that with, well, I shouldn't bend forward at all, I shouldn't do deadlifts or those things. But what we're saying is that, it sounds like what you're saying is, to hinge at the hips, you're actually moving from your hips. Even though your back is tipping forward, your back stays in that neutral position. You're not seeing the rounding or the arching of the back. It's staying fixed, it's staying rigid, and you're moving from your hips to pick up that weight. So I just wanted to clear up, and if you want to add anything to that bending from the back, rounding from the back, those things we're talking about are different than actually bending forward and hip hinging.
Yeah, no, that's a great point. I actually just yesterday, it was Saturday, which was 2 days ago from the day we're recording this. We were doing some USA weightlifting movements, working on the clean in the different positions, position 1, 2, and 3 on the clean. And when I was teaching the athlete to go from position 2 to position 1, which is from the knee to the hip, I was trying to tell him that it's only hips, but he's like, well, I'm using my back. And I was like, well, you look at your movement, your back, yes, it's moving through space, but the back itself is not actually rounding or extending or moving at all. It's just working on improving use of the hips. Working on utilizing your glutes. Like I said, strongest muscles in the body. I mean, since we're on this subject, it's almost a pet peeve of mine that for some reason 75, if not 90% of the world thinks that if they want to pick something up off the ground, they should be bending their knees and squatting. Well, the easiest way to point out why that's incorrect is the deadlift. Deadlift is literally picking something up off the ground, and it's the way you can do it. The way you can pick up the heaviest possible object off the ground is using a hip hinge or a deadlift, not a squat. If you try to squat to pick up that barbell off the ground, there's no way you're going to pick up nearly as heavy a weight as you could a deadlift. And that's because the deadlift is utilizing your glutes more than your quads, which is what the squat would recruit. So if that's how we're picking up these weights and it's very healthy for our bodies, for our low backs, then why is everyone bending their knees and squatting down low to pick something up? I mean, if you squat down to pick up a pencil off the ground that you dropped and you do that, with everything all the time, I mean, that's a recipe for injuring your knees and injuring your back, because you're just going to overload them. They're just not built to do that. So very often I have to teach people just, how to relearn how to pick something up safely off the ground. And eventually, you'll drop something and you go to pick it up and you just naturally hinge at the hips, very safe, very healthy, and it'll be very easy. And, it's a game changer. But that's didn't mean to jump off onto that topic there, but that's a big one that I just felt like I had to say.
No, I have the same pet peeve as you. So I think that was a welcome tangent, one that people need to hear, because people assume that, and especially people that have back pain, anytime they bend forward, it increases their back pain. So they think that bending is bad. They think that hip hinging is bad, and they think they have to squat to pick something up. When in reality, it's your ability or your lost ability to properly hip hinge, to properly do the things that we're talking about, stabilizing, moving in the right way, that is causing your pain. So it's not a matter of avoiding that movement. It's a matter of retraining it, relearning it, learning how to use it with the right muscles helping out.
Yeah, 100%.
Sweet, man. This is this has been awesome. I'm excited for you to get the exercises over for people listening, that they can follow through. That mobility sequence is going to be a great starting point for probably anyone. Definitely no one's going to be hurt from it, especially if you're working into your warm up. It's a great way to hit some of those areas. Some of the big takeaways though that have been gathering from it for you guys listening is, make sure you're addressing the lifestyle factors first. Sleep, as Andrew talked about, is one of the biggest overlooked things. Your work postures and your exercise program, those big three lifestyle factors are all going to be good starting places to look when it comes to addressing back pain. When you go about actually addressing your back pain or trying to prevent it, think about these big three categories that Andrew's talked about, from the lifestyle side of things, and then also from the movement side of things. So having he talked about midline control, good ability to control what your back is doing, avoiding overarching, avoiding flexion that can cause pain, addressing your mobility so that you can get in those positions. And then from a stability standpoint, training the back to prevent movement rather than to produce it. So those were some of many big things that, I wanted to summarize, because I think you did such a great job talking about all those things. And anything you want to add, I think that, the big takeaway for people from my standpoint is that there's a lot that goes into back pain, and you have to be attacking this from a lot of different angles.
Yeah, no, it's just, everything happens for a reason. I mean, the human body, there's a lot that is, still misunderstood out there. But I mean, when it comes to back pain, there's not a mysterious, there's nothing mysterious about it. It's just a matter of understanding movement and anatomy, and the way, and just peeling back the layers, and to truly take care of it long term, and to get out of that cyclic pattern that a lot of athletes are stuck in, where they feel good for a couple months and they have a flare up, and then they feel good for a couple months flare up. You got to get to the root cause. I mean, I can't emphasize that enough. What is the root cause? Exactly as Dave mentioned, paying attention to the little things, the things outside of training, that add up over a long period of time, the sleeping positions, the sitting for long periods, the standing for long periods, or, whatever the case is. It's just, it's something that, if not addressed, just leads to repeat problems.
Yeah, and if it's not normal if you're, it's common, but it's not normal if you're experiencing a setback with your low back every 6 weeks, every few months, even every 6 months. Like if you're in that category that you're like, oh, well, a couple times a year, it's guaranteed that my back's just gonna, kind of blow out on me and I'll be out of commission for a week or two and then I'll be back into it. I want you guys to know that that's not normal. You're not addressing the true root cause of what's going on if you're falling into that category. And just because that's common does not mean it's normal. And I think that's one last thing to definitely clear up.
100%. Three more.
Yeah. So, and awesome stuff on the backside of things. Got a couple questions here, real life application type questions that we're gonna wrap up with to hear from you because, seeing from the outside for you, you got a growing practice, super successful business owner. You're growing in the Charlotte area, a newer area for you, and building up a real successful practice. You have another staff PT underneath you. You're crushing it from a fitness standpoint too. I know when you talked about the joint muscle analogy, you said that the wall is going to win if you try and push it down. But if I know anyone that could push the wall over, it's probably you. I mean, you're a beast. You're a beast for people that know you, and there's just a lot of good things going on in your life. You're doing this teaching. You're pouring out into other practitioners and helping them grow. And it's just easy to look from the outside when we hear these credentials, when you see your practice, when you see you as a person, and think that you have it all together and you have it all figured out. And you and I both know that's not in reality the case, but it's easy for people looking from the outside to maybe see that or assume that and get caught in a comparison trap. So if you wouldn't mind being real with people listening out there, especially for, guys, it's hard to be vulnerable. It's hard to be open. It's hard to admit mistakes and flaws. What's a challenge you faced in the past, something you're going through now, some kind of challenge that has ended up being a catalyst for your growth as a man and as an individual?
Yeah, no, Dave, I'm glad you brought that up because from everything we just talked about, I could definitely see how people may think that I'm drinking the special green juice or something, but no, I mean I have my struggles for sure, and the biggest I think change in my life that has allowed me to accomplish what I've accomplished and just be really happy in all aspects of my life is just understanding that there's multiple areas that areas of our life that need to have balance, and they need to all equally be addressed. And if I were to divide these into, I don't know, 5 or 6 categories, these areas I'm referring to are my career, my mindset, my finances, my relationships, spirituality, my emotions, and friends and family. And what I found that has allowed me to just to love life and to make the most of it is to have balance in all of these categories. There's no way I'll be able to accomplish what I've accomplished from a career standpoint if I didn't have solid, if I didn't feel good with my relationships, if I wasn't able to control my emotions and I let myself, react to situations or, dwell on things or focus on the past or the future too much, there's no way I'd be able to do what I do. And the day that I discovered that I need to have balance in all of these key areas of life was the day that allowed me to love life to its fullest and to accomplish, as much as I have, but also, it's having a great mindset, having great relationships, and, all these aspects, having equality in all of these, different components has really allowed me to be my best self, to be the best version of myself. And very often people get so caught up in business and career, and they get so caught up in let's just say their emotions, and they neglect family and friends and their mindset, and then when you lose balance and you can't be the best version of yourself, and you won't live your happiest life. And so yeah, highly recommend, simply sitting down and evaluating where you're at in each of those categories. You could even give it a 0 to 10 score if you wanted in each of those categories. And whichever categories are scoring the lowest, a little bit more time, a little bit more effort, a little bit more energy into those categories, and it'll be life changing. I mean, it was for me, and I know it would be for all of you guys. So again, it's, and you can kind of tweak these categories to whatever y'all feel is appropriate. But what I found is business career is one, mindset is another, emotions is another, finances as a whole, relationships, friends and family, and spirituality. And so just keep in mind all of those, and making sure they're well balanced. That was very super key for me in my well-being.
I really appreciate you sharing that. That's something that I know, a lot of guys I've talked to struggle with. It's something I've struggled with personally. Is it's so easy to get caught in, only a few of those categories. And then all of a sudden you're letting, maybe it starts with only letting one category slip. And then all of a sudden 2 or 3 are slipping. And then you wonder why you're losing the joy out of things. You wonder why you feel off. And if you're neglecting those areas, that's going to catch up sooner or later. And I think it's, 100% agree with you. Something that most guys would benefit from going through and actually scoring themselves 0 to 10. It's something that it's not a one-time thing either. This is personally something I review every single week on Sundays. I'll go through, and it doesn't take long, but to go through, write these categories out, give them a 0 to 10 score and a couple quick notes of what you're doing well and what you can improve on. And that's been amazing for me as well. So I appreciate you sharing that.
Yeah. 100%, man.
So last thing here, and this kind of bleeds in with the last question, but it's our hypothetical scenario for all the guests on here. So you're leaving a favorite coffee shop in town, favorite restaurant, favorite brewery in town, and you run into your younger self of 10 years back. So younger Andrew asks current Andrew for some life advice, looking for some guidance. You're on your way to important day, full of patients you're seeing. So you only have 60 seconds to talk with him. So got to keep you brief on this. What are you saying to him? What advice are you giving to him for the younger Andrew of 10 years younger?
Gosh, I wish I had something groundbreaking to tell you, but it's literally exactly what I just went over before. Is I would tell him to stop focusing so damn much on my career and making money and all that and being successful, and to live in the moment, enjoy the process. Not the end game. Have balance in all those different aspects I mentioned, and enjoy the process, because it's so easy to get caught up in getting stuck in the rat race. And at the end of the day, it's how well you enjoy the process is how well you live your life, and that's the time that you spend. It's not just the outcome, whatever that outcome is. So it's just taking time to make sure all your cups are full in all those areas, and that's how essentially you enjoy that process. So I wish I could go back and say that to myself, for sure.
Sometimes we take a little longer to learn. Appreciate you sharing that, though. That doesn't have to be groundbreaking, but that's man, if you're just doing that, that's a pretty darn good start. So thanks for sharing that, Andrew. It's been awesome, man. I appreciate you being on here, sharing so much great knowledge. Where can people find you? We're going to put those videos in the show notes to link to your YouTube channel, I'd assume, but where else can people locate you if they're interested in reaching out?
Yeah, I mean, the best way to get a hold of me is probably through Instagram. My handle is @TheCharlotteAthlete. Certainly y'all can email me, andrew@thecharlotteathlete.com, if you have any specific questions or wanted to discuss any topics we went over. Be glad to take a moment and help you out any way I can. You can also find us on Facebook or our website, which is thecharlotteathlete.com.
Awesome, man. No, it's a lot of fun. Appreciate you being on here, and go get your backs right. This is something that don't take lightly, because if you haven't experienced yet, you're going to. So stay on top of it, and I appreciate you sharing all this, Andrew.
Dave, I had a blast. Thank you. Appreciate it, man.